Ever wake up with a stiff back and think, I'm just getting old? What if it's not just aging? What if it's something more serious like ankylosing spondylitis? This isn't just about the occasional backache or stiffness. We're talking about a chronic inflammatory disease that primarily zeroes in on your spine and back. It's a type of arthritis that doesn't just cause pain. It brings stiffness that's most notable in the mornings and after you've been inactive for a while. You might be thinking, arthritis, but that's for old people, right? Not in this case. Ankylosing spondylitis doesn't discriminate based on age. So whether you're in your prime years or enjoying the golden ones, it's essential to be aware. Knowing about ankylosing spondylitis can be crucial to maintaining your health. So let's dive into the details. Scene script, wondering what to look out for. Let's talk about the symptoms. Ankylosing spondylitis, or AS, is a chronic inflammatory disease that primarily takes a toll on your spine and back. One of the most common symptoms is a persistent pain and stiffness in the back and joints. This discomfort is particularly noticeable in the mornings or after prolonged periods of inactivity. It's a bit like that feeling when you've slept in an awkward position. But in this case, the stiffness doesn't ease up as you start moving around. This rigidity can last for at least half an hour and often improves with exercise or a hot shower. This pain and stiffness usually begin in the lower back and hips, but over time they can spread up the spine and even into the chest and neck. You may also experience inflammation and pain in other parts of your body, such as your shoulders, hips, ribs, heels, and small joints of your hands and feet. Another symptom is fatigue. This isn't just the usual tiredness after a long day, it's a profound exhaustion that doesn't improve with rest. This fatigue can greatly impact your daily life, making routine tasks feel like uphill battles. Ankylosing spondylitis can also cause a reduced range of motion, especially in the spine. This can make it difficult to perform everyday activities and can even affect your posture, causing you to hunch forward. It's important to note that these symptoms can easily be mistaken for regular back pain or signs of aging. That's what makes awareness so crucial. Many people dismiss these symptoms thinking they're just part of getting older or the result of a strenuous workout. But if you're experiencing persistent back pain, stiffness and fatigue, it might be more than just the wear and tear of everyday life. If you're experiencing these symptoms, it might be more than just regular back pain. It could be ankylosing spondylitis. So you have the symptoms. But how do doctors diagnose ankylosing spondylitis? Well, it all begins with a thorough discussion of your medical history. Doctors will ask you about your past and present health conditions, as well as any symptoms you might have experienced. This helps them gain a clear picture of what's going on and what they need to look for. Next, a physical examination is performed to assess your overall health and to check for any signs of inflammation or stiffness, particularly in the back and joints. This hands-on approach allows doctors to directly observe any physical manifestations of ankylosing spondylitis. But the diagnosis doesn't stop there. To further confirm their findings, doctors will order a series of tests. This could include blood tests and imaging scans. Blood tests, such as the HLA-B27 test, ESR test, and CRP test, are essential in measuring inflammation levels. These tests can indicate the presence of ankylosing spondylitis and help in assessing the severity of the disease. Imaging scans, on the other hand, provide a detailed view of your spine and joints. X-rays and MRI scans are commonly used to detect bone erosion and joint inflammation, two key indicators of ankylosing spondylitis. These scans give doctors a clear image of what's going on inside your body and can reveal any structural changes to your spine or joints that may be caused by the disease. Finally, doctors use what's known as the Assessment of Spondyloarthritis International Society, or ASAS, classification criteria. This is a set of guidelines that helps healthcare providers give a proper diagnosis for ankylosing spondylitis. It takes into account various factors, including symptoms, test results, and medical history, to ensure an accurate diagnosis. Diagnosing ankylosing spondylitis is a thorough process, but it's crucial in managing the disease and its symptoms. Because remember, an early diagnosis can significantly improve the quality of life for those living with ankylosing spondylitis. It facilitates prompt treatment, which can slow down the disease progression and help manage symptoms more effectively. So if you suspect you have ankylosing spondylitis, don't hesitate to seek medical attention. Your health absolutely deserves it. Once diagnosed, what's next? Treatment, of course. Ankylosing spondylitis, while chronic and currently incurable, is not a life sentence. There are effective ways to manage the symptoms and slow the progression of this disease. The first line of treatment often involves medication. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, can help reduce inflammation and alleviate pain. In some cases, disease-modifying anti-rheumatic drugs or DMARDs might be prescribed. These work by targeting the immune system, which is overactive in people with ankylosing spondylitis. Biologics, another type of medication, can also be used. They specifically target the molecules that cause inflammation in your joints and spine, offering relief from pain and stiffness. But remember, every medication comes with potential risks and side effects. It's important to discuss these with your healthcare provider to make an informed decision. Physical therapy plays a vital role in managing ankylosing spondylitis as well. Regular exercise can help maintain flexibility and strength, improve posture, and reduce pain. A physical therapist can guide you through specific exercises tailored to your condition. In severe cases, when medication and physical therapy are not enough, surgery might be the next step. This can range from joint replacement surgery to spinal surgery. These procedures can often significantly improve quality of life, but they're usually considered a last resort due to the risks involved. Of course, living with ankylosing spondylitis also means making lifestyle changes. A balanced diet, regular exercise, good sleep and stress management can all contribute to better symptom management and overall well-being. Remember, every case of ankylosing spondylitis is unique. What works for one person might not work for another. It's about finding the right balance of treatments that work best for you. Though ankylosing spondylitis is a lifelong condition, it doesn't have to take over your life. With proper treatment, you can manage the symptoms and maintain a good quality of life. Now that we've covered the basics, you might have some questions. Let's answer some common ones. Firstly, a question often asked is, can ankylosing spondylitis lead to other health conditions? The answer is yes. While primarily impacting the spine, it can lead to complications in other parts of the body. For instance, it could result in heart problems, lung issues, or even inflammation of the eyes, known as uveitis. It's also common for individuals with ankylosing spondylitis to have coexisting conditions such as psoriasis or inflammatory bowel disease. Next, what lifestyle changes can help manage symptoms? Well, regular exercise is a significant part. It helps maintain flexibility, improve posture, and reduce pain. A balanced diet is also crucial, as it can help manage inflammation. Additionally, quitting smoking is imperative, especially since ankylosing spondylitis can affect lung health. Another common inquiry is, are there support groups for people with ankylosing spondylitis? Absolutely. Support groups can be a fantastic resource. They provide a space to share experiences, learn from others going through similar experiences, and gain emotional support. Many national and local organizations offer such groups, and there are also online communities available. Lastly, is there a cure for ankylosing spondylitis? Unfortunately, there is currently no cure for this disease. However, treatments are available to manage symptoms and potentially slow the disease's progression. These treatments include medication, physical therapy, and in some severe cases, surgery. Understanding ankylosing spondylitis is the first step to managing it. Remember, knowledge is power.